For many years, quality health care remained out of reach for millions of families across Nigeria, as decades of neglect had weakened the country's primary health care system, leaving behind dilapidated health facilities, frequent shortages of electricity, water, and lack of medical equipment and essential commodities, as well as an overstretched and inadequate workforce, among other challenges. As a result, trust in the primary healthcare system was eroded, but today, that trust is being rekindled. In 2023, hope was renewed as the federal government, through the National Primary Healthcare Development Agency, launched bold reforms to restore public trust. This included the revitalization of primary healthcare centers, the provision of medical equipment and essential commodities, and the retraining of frontline health workers.
You know, when we came into the position in 2023, one of the first things that we did, which is, always a good way to start, is to understand what are the biggest challenges, facing the primary healthcare system. We did assessments to try to figure out what was the bottleneck, because we were also aware that even before we came, investments had been made in primary healthcare, but they didn't necessarily translate to the outcomes that we wanted to see. One was that the trust that Nigerians had in the primary healthcare system had eroded significantly. People didn't believe in what the primary healthcare system had to offer them, and there were reasons for that. The quality of the services, the reliability of the services were very problematic at the time. So it became very clear that among the things that we needed to do, we needed a push to improve the primary health care system.
By revitalizing 1,901 PHCs, with work ongoing in 1,752 others, and ensuring consistent service delivery, the federal government is restoring people's confidence that quality primary health care is available within their reach.
We are going to 17,600 functional facilities. We want every ward to have at least one facility where you can say it's fully functional, meaning it's providing 24-hour services. To do that, it has a building that is conducive and dignified. You have staffing, at least 4 skilled birth attendants with accommodation.
Our staff strength has increased to normal standards. It has improved our coverage in the facility in terms of deliveries. So we have great numbers of women now delivering in the facility. Unlike before, we hardly see women.
So many of these facilities are being solarized, we are standardizing that as a component of our PHC revitalization. They require wash services, meaning water and sanitation. So many are having solarized boreholes now, as part of the revitalization.
Training and new uniform have reignited confidence among health workers, and the community can feel the difference.
To complement the ongoing federal government retraining exercise for 120,000 frontline health workers nationwide. And that is why the Renewed Hope Initiative procured 60,000 branded scrubs and 60,000 pairs of Crocs as an incentive to encourage and support the tireless dedication of our midwives. in line with the renewed hope agenda of His Excellency President Bola Ahmed Tinubu GCFR.
I registered for Karo Primary Health Care. I like the way they are attending to me. They are so caring about their pregnant women. They used to laugh with us. They don't ask on us. So I like them very well. And I like the uniform, the new uniform now.
Trust grows when there is transparency, where data is used to track performance, improve outcomes, and ensure no community is left behind. The goal of the NPHCDA strategic blueprint is to ensure every Nigerian has equitable access to quality PHC services they need through a system that they trust. Just how far has the agency gone in rebuilding citizens' trust in the PHC system?
We're on a transformation journey. It's a journey. It's not a switch on or off. It's not a one-time thing. But how do you measure trust of citizens in the system? It's the way they engage. It's the way they utilize the system, you know? And if you look at just the raw numbers as we're having it, in the second quarter of 2025, we had over 40 million service contacts with our primary health centers. If you compare that to 2 years ago, that's a significant jump. What that tells you is that Nigerians are hearing and seeing the effort of the government.
The NPHCDA recently supplied medical equipment and essential commodities to PHCs and selected secondary and tertiary facilities. What informed extending this support beyond the PHC level, and how does these align with the goal of NPHCDA?
Many women who die around childbirth is because they need emergency services that are not, the primary health centers are not able to provide. Most under 5 deaths happen in the newborn period, what we call neonates, in the first month. That's because of resuscitation of babies that are born with a challenge or the other and keeping them alive. Once a woman or a child requires services that are beyond your capabilities and there is no referral center that is equipped or able to cater to them. So what we're doing is, with the limited resources that we have, is identifying high volume critical locations around what we call the MAMI LGAs, the 172 LGAs that are driving most of the mortality, to see what referral sites will service them and investing selectively in some of them. In fact, as part of an MOU that we have with states, is that when we invest in one, you need to do a few, 2 or 3, depending on what the situation is, in exchange to merit this.
The journey continues. Sustaining trust means keeping promises, consistent and quality services, motivated health workers, and continued community partnership. Trust, once lost, can be rebuilt through action, integrity, commitment, and care. Nigeria's primary health care reform is rekindling that trust. One PHC, one health worker, one family at a time.